explain a little bit about their programs, and they're also going to be available after all the talks to answer some questions. We started a little bit late because people kind of filter a little bit slowly. I do expect some more people coming as well, so don't be surprised if there's a little bit more plus. But I'm really very glad that you came. Everybody should have an agenda, and it talks about who's coming up. I just want to start the evening with a little bit of a prayer here to start. So we'll bow our heads and thank our Father. Dear Heavenly Father, thank you for bringing us together this evening for this very important event. Please help us to learn as much as we can in order to utilize the information that we have to be successful in our careers, successful in our lives. And that success, dear God, depends upon you and your plans for us and how well we implement those plans. Please be with us tonight, with all of our recruiters and our students, and give them a wonderful, safe year, and bless this event, dear Father. In your holy name, amen. So, first up will be our College of Medicine, Ms. Wong. Come on up. I do have a little picture for you. Oh, good. Now, we don't have a microphone tonight, but the acoustics in here are pretty good, so I think we'll be okay. Thank you, Ms. Wong. And there's some others. And the button back. Thank you. Thank you. Very good. We'll take this one.
All right, thank all of y'all for coming to hear about MUSC. It's a great institution, and we do have 6 colleges. And so I'm going to represent the College of Medicine. I'm the Assistant Dean for Admissions in the College of Medicine. And I'm just delighted that y'all come and you've shown an interest in the health professions. And so thank you for giving attention to each one of the colleges as we come up. Every college has a little bit different requirements for what you need to do to prepare yourself to be there. So I'm going to talk with you a little bit about medicine. And several people who work with me are here also. And we're going to be able to answer questions afterwards. But I also brought Jamal. Jamal is one of the students who graduated from Charleston Southern, and coming this afternoon he told me that he remembers coming 3 years ago when we were here listening to the presentation about the College of Medicine. And he said, I don't remember too much, but I do remember I left thinking I've got a lot of studying to do. So he did great. He came on into medical school, and he's now finishing up. He'll be finishing up his first year. So he'll be available to talk to y'all after I told you sort of what you have to do to get in. Now, all of us have known physicians, and when you graduate from medical school, there are many, many specialties you can go into. And so you don't have to come in knowing what you want to do. A lot of students do feel like they know they want to be a pediatrician, or they want to be family medicine, or they want to be emergency medicine. But really, as you go through that curriculum, you're going to be able to figure out what you love best. And many of our medical students change once they get there and decide they want to do something else. So these are some of the specialties that our students go into when they graduate, and they go all over the country. And so a lot of the students, with the exception from South Carolina, but many of them end up doing specialties in areas like California, Boston, New York, Florida, just all over the country. So what do you have to do to be one of these positions? These are the entrance requirements. You have to get your BS or BA degree, and we don't care what it's in. The major does not matter to us. Now, because you love, or you want to go into one of the health sciences, you really have to love science. And so probably 65% of our class graduated with a degree in biology and chemistry, but we have students who come in for music majors, art majors, English, history, you name it. But you have to take these recommended courses to take the MCAT and do well, and to do well in medical school. And so you can see up there's biology, chemistry, organic chemistry, and physics. And then we also suggest some other courses if you have time to take them. But you're going to have to take those courses, and you have to take the medical college admissions test before you come in. The highest possible score you can make different sections, and 15 in each section is a perfect score. So if you have 45, you have a perfect score. The mean of the accepted classes is 30. And so that's kind of what we look at. There is a writing sample, but that's graded with a letter, and the MCAT people do that specifically so colleges won't turn that into a number, because they say there's really no way to equate that to a number. And so we look at the writing sample, but really what we're looking at is the total score of the other three sections. This just gives you an idea of how many applications we get each year. This year we had right at 3,600 or 3,500 applications. We're primarily looking at the in-state numbers. So if you look at 650 in-state, and the other 2,884 from out-of-state. We do take out-of-state students, but usually about 10% of our class is out-of-state. We take 160 students, so virtually I'd say 16 of those students come from out-of-state. So when we get all those applications, we have to determine who we're going to interview, because you do have interviews. We have to look at your cumulative GPA and your best MCAT. So I guess the advice I would give y'all tonight is whatever year you're in, just do as well as you can do academically, because it is going to come back and mean something. We do have students who have lower GPAs. They eventually may get medical school, but they really have to go and get a master's degree to make up for any kind of low GPA that they have from their college. So just keep trying your best. Q GPA is around the 3.6, and Q best MCAT's around the 30 for people who get medical school. Once we decide to interview you, you're going to have 3 interviews, and everybody fears these interviews. They're like, oh gosh, what are they going to ask me? And so just know they want to find out what you're all about, that you really want to go to medical school, and that you've given it lots of thought. So we interview about 450 students each year for that class of 160. We give 3 interviews each, and we interview from September through the middle of March. We actually are almost on the tail end of selecting the class for this fall. These are the things we look for when we interview you. We want to make sure that you have, that your confidence inspiring. Because think about positions that you've been to. You want to go to doctors that you can relate to. They have good interpersonal skills. They're compassionate. They are concerned about you. They have motivation. They're just the kind of people that you want to emulate. And so we look at just your whole demeanor. And I tell students a lot of times you can't really practice too much for an interview because you don't know what you're going to be asked. And a lot of it is how you've been raised for such time. It's just your whole overall demeanor. So that's what you're being rated on when you're being interviewed. The other thing that you really need to be working on now if you're thinking about going to medical school, develop relationships with some of your faculty who can write you strong letters of recommendation. Just a letter saying this student made an A in my class, that is not a strong letter of recommendation. It's good that you made an A, but we want letters that speak about your ability to relate to people. How did you relate to your classmates? How did you manage different tasks that they gave in the course? And so get to know some of your professors. Join clubs, join activities that go on at Charleston Southern, because we want to see that you have some kind of leadership. Physicians are leaders. You've got to lead the health team. And so you've got to have some background of leadership. Volunteering, charitable works, anything you can find to do in the neighborhood, you want to do. Because if people ask you, why do you want to go to medical school? The standard answer almost is, I want to help others. But that's not the right answer to give when you get interviewed, because somebody can come back and say, well, you can help others by being an environmentalist. You can help others by being a pharmacist or nurse, but why is it medicine? So think about that. But they want to see that you have been in the community and volunteered, because you really do want to help others. And the other thing that's absolutely key is you have to have shadowing experience. You have to have followed some doctors around to know what it's like to be a physician. You have to have that clinical study of medicine. And I remember being with a nursing recruiter one time from MUSC, and she said to the students, it sounds awful, but you've got to get in the hospital and smell the smells and see the things that we see on a daily basis and know that's have to go through the entire medical school curriculum, and you have to go through all kinds of rotations, psychiatry, OB, family medicine, pediatrics, surgery, internal medicine. You can't just say, I want to be a pathologist, and I'm never gonna talk to people. You still have to get through that coursework. And so, exposing yourself to as many aspects of medicine as you can. So when we finish it all up, 25% your GPA, 25% your MCAT score, 25% your personality in those 3 interviews, and 25% is your accomplishment. So you do see students who don't get medical school with extremely high grades in MCAT scores, they don't have the other things. This is our class last year, we took 162 students. The average GPA was a 27, and the average MCAT was 30. And we say 18% of the class is underrepresented. So 11% of our applicant pool last year was underrepresented, but we have 18% that's in our class. This is the contact, we can't, this, I could really stretch this out and talk to y'all for now, but you've got to hear from 5 other colleges. So these are contacts, and I've got a sheet over there that will give you this information, and you can just take it with you, and later if you have questions, of course, you're gonna come by our table and ask too. But keep it with you, because you're gonna need to contact us in the next year or two as you get closer to applying to medical school. And then this is our website. You can find us on the web, very easily. You can click on there and find all about the College of Medicine. You're gonna be able to see a video about, the medical school. And, we hope that you will be applying in a couple of years or a year or whatever, because we would love to see you. So come by and do talk to us after the presentation.
bit too much. Well, I guess when they put these slides together, they want to tell y'all about all the skills and everything that we do. But for the most part, for y'all, I'm sure your job concern is how y'all want to get into school here. So let's just jump on over to that. A lot of people want to be dentists because they think it's a lot of money. These are the average income of a lot of dentists, orthodontists, and specialists. I didn't want to skip over this part, and I gotta tell you that sometimes a lot of them actually make more. Sometimes they'll make more than $200,000, and sometimes they'll make a little bit less than $200,000. That's depending on patient load and where you live at for the most part. All the rest of the stuff are reference. Pretty much the same. It's pretty good. But here's what y'all need to know about getting middle school. So y'all need a DAT score. It's just like the MCAS. There's different subjects. We also have math. We have organic. We have biology. There is no physics on there, but we have a conceptual ability part too. And the highest score you can get on DAT is 30. And there's two different scores. And both of them can be 30. Conceptual ability is scored differently from all the subject material like math and sciences. Generally, in what I have been seeing at the school is that the average is around 1920, 1919 to get in, just get an interview. Basically, you have to have a college degree. I know it says the minimum number is 3 years. Basically, you need a 4-year education. They don't take anybody anymore. You don't have a college degree unless you have a great excuse. Of course, you have to learn evaluation, official transcripts. Three letters has to be from your professors. 1 letter has to be from the academic community or either that or either way they have to go by it. Here are the prereqs. You need organic, general chem, biology, physics, English, mathematics, science, electives. Sometimes prereqs can be substituted, but you have to ask the school if that is appropriate or not. And we have these are basically the days where they just want you to fees and everything, applications, dates. I suggest y'all just write all these down if any of y'all are thinking about going into dental school. I know it seems like I didn't put together this application. I mean this application, this PowerPoint. I didn't put it together. My experience here at school at MUSC is a great experience. Seeing y'all ever think about going into the health field would behoove y'all to stay within state. The goal of, I think, of most programs at MUSC is to keep your kids in state. That's why the majority of the kids that apply, that they accept in school, a higher percentage is from in-state, a lower percentage from out of state. It also behooves a lot of people who are minorities, such as Hispanics and African Americans. A lot of part in dental school, we have a shortage in African Americans and Hispanics coming in, and you gotta think about that. So you're graduating one African American male, one African American female, and maybe one Hispanic male a year, but the population is totally different out there. We have like 30% African American, maybe 20% Hispanic, and maybe you have about 7 or 8 or about 60% white out there, and it's basically a disparity between the numbers of basically minorities that are coming into school and graduating, and the minorities that are out there in the general population. I wouldn't give that back for the world. What I learned from this school and how much they really do care and how much, faculty and staff take care of you, I'm glad I chose to go here. Even though it costs a lot, but like, it's a worthwhile experience. And I'd say like this is like, if any minorities are thinking about going into dentistry, this is a good time to apply for MUSC, and definitely male minorities, because let's see, 3 black males and 1 Hispanic male in the dental school. And each class has about, the juniors and seniors have about 56 students in each class, and the sophomores and freshmen have 70 students in each class. That's a big percentage difference right there. So I just like, I hope y'all do choose industry. If y'all have any questions, come over here and talk to me. I'm sorry, too. She did tell y'all about GPAs and everything like that. Since I've been in school, I've noticed a trend that GPAs of kids getting accepted in school has been going up. And that's within the last 3 years. It's a pretty competitive school to get into still. So definitely keep up your A's and B's, 3.5s, 3.6. I know a lot of kids are basically average nowadays. And I already tell y'all average kids scored in 2019. I want to make sure y'all know that. Okay.
Next we've got Dr. Kelly Rigucci from College Pharmacy. We have your name.
All right, well, let me start by saying that all of the, I've been at MUSC for a while. I did my residency here and there. And now I've been on faculty for about 13 years. And any of these colleges were, MUSC is very well respected, all of the colleges. The fact that you guys are here wanting to go into some health profession, whether it's dental medicine or nursing or pharmacy or medicine, is a good thing, because it's a good area to go into healthcare. Population's aging, people are always going to need medications and need physicians and nurses and dentists, and it's never ending. So it's good for, it's good in general. It's a good career move to go into the health professions in general. But let me tell you a little bit about pharmacy and about our College of Pharmacy in particular. So pharmacy school in general, just to give you a little background for those of you who may not know. So it used to be, back in the day when I graduated, it was a BS. You got your bachelor's degree in pharmacy, and then you could choose to go on and get a doctorate if you wanted to, which is what I ended up doing. Well, now we have made it a requirement to get a doctorate in pharmacy, or PharmD, as we call it. It's 4 years of school. Generally speaking, the 3+1, 90% of the colleges of pharmacy in the country are 3+1, where you have 3 years of didactic kind of classroom instruction, and then 1 year out on rotations doing experiential rotations. There are a few schools that do 2 and 2, so 2 years of didactic and either 1.5 or 2 years of experiential, but most are on the 3+1. And the NAPLEX and MJPE, the NAPLEX is and the MJPE are the exams that you have to take to pass. After you do your 4 years, you take the boards, and once you pass, then you become a pharmacist. The MJPE is the law portion of it, and the NAPLEX is the more of the knowledge-based drug stuff. And then a little bit about our college. So we've actually, about 5 or 6 years ago, we merged. It was Dr. Greenberg, who's the president of the university, they had some initiatives to merge and do some joint ventures with USC. So we are now the SCCP, the South Carolina College of Pharmacy. We have our campus in Charleston, campus in Columbia. Now, actually, we have the choice for our third-year students to go up. If they're from the Greenville area, they can go up there, and we do a lot of distance education. So why our school? And there's a few slides in here I won't spend looks like now, but we kind of have changed, and we're kind of progressing. Most schools are going to this kind of model where instead of doing all of the basic science stuff in the first year and not getting into the clinical piece of it until the third year, we're integrating the basic science and the clinical sciences. So we're teaching the pathophysiology, pharmacology, and pharmacotherapy all at the same time. And so as you're learning about cardiovascular disease or neurology or whatever, you're learning about the pathophys pharmacology at the same time that you're learning about the clinical application of it in patients. So it's great. And the faculty are working together to make that happen. So I'm really excited about this new curriculum. The fall 2011 students, our first year students are the first ones to go through this new curriculum. We do have research programs, graduate students as well. We have opportunities to do, and I think this is on maybe another slide, we have dual degree, PharmD PhD, or you can do a PharmD MBA for those of you who are more interested in the business aspect. And I can talk about that more in a minute. Our faculty, like I said, we have a good, I think, variety of new kind of fresh blood faculty, and then we also have people who've been here for 40 years, and I think it's good to have that mix. Some history, it's good to know the history sometimes for the new folks, but it's good to have that new, energetic, faculty member coming in as well. And we have the second largest pharmacy residency program in the country, next to Chicago, UIC. We have 25 pharmacy residents. So after you graduate with your PharmD degree, you have the option to go and do a residency or a fellowship if you're more interested in teaching, in clinical work, or in research. You would do the a fellowship. So a little bit more. I told you a little bit about the curriculum length there, and basically I guess what I didn't mention was in that fourth year where you do the rotations or the experiential part, there are 9 rotations that you have to do. So it's not 12 months of the year, but it's 9. 6 of those are required, and 3 you can do anything you want, elective rotations. And there is a requirement to do we call it the grand rounds or seminar in your fourth year, where you have to do a 45-minute presentation in front of the faculty and on some new drug or some clinical controversy about a drug, and it's fun. Everybody stresses about it, but it's a fun thing. And then in the required curriculum, we have, of course, our required pharmacy courses and labs, and you have labs throughout. Every semester you have a lab. You might have a community lab, a hospital lab, a compounding lab. There's a clinical assessment lab. There's a lab in every semester. It's 1 credit hour. And then you do, throughout the curriculum, there are 8 hours of elective courses that you're required to take. So basically, and you don't take electives in your first year. It's all in your second and third year. So it's pretty much 2, 2, 2, and 2 to get your 8 hours. All core courses now, because we are distance, kind of a distance education college, are taught through DE. Although I should say the labs are not, but most of the core courses are, the didactic lectures are. And a lot of people question, well, if I'm on the Columbia campus or if I'm on the Charleston campus, when do I have the live lectures? So we try to really match it up well, so that about 50% of the lectures come from Columbia and 50% from Charleston, and the faculty kind of, again, we take turns doing those lectures. We have all of our lectures, and it's kind of unique. There are a few other colleges in the country that have multiple campuses that do the same thing, but not many, where we record all of our lectures. So if you happen to miss class, if you're sick, something comes up, you can always watch it later. Or even if you were in class that day, if you want to study for the class, maybe before the next test comes up, you can re-watch it again. So everything's always recorded, which a lot of our students said was a big plus, that was an opportunity. And this is just a picture of the distance technology. Somebody teaching, if I was at the podium down in Charleston teaching, and I would be standing there, and unfortunately my face would be blown up on the big screen for the people in Columbia. And you can see in this case, it's a person in Columbia teaching, and you can see her on there. You can actually set it up where one TV shows the person teaching and the other one has the slides. Most people use slide sets, so both are on there. But our IT people are great, and they really can do whatever the students want. They try to work out. I would refer you always to our website. It's a little light there, but sccp.sc.edu, and that will give you any additional information you want about. There's a section there about prospective students. I don't think if I can get back to contact sheet real quick. It'll pop up here. There we go. So this is our main webpage. If you would go to students and then prospective students, and then there's PharmD. You can see PharmD admissions, the academic program, so that tells you a little bit more about the curriculum and the PharmD program itself. There's financial aid, scholarships, campus life, that sort of thing. So I would just refer you to the website. Again, it's sccp.sc.edu. A lot of people try to just do sccp.edu, and then don't get there. So I'll refer you there. Just some bullet points about the application, and your application considerations. These are the sorts of things that we look at. It's very similar to what Wanda mentioned with College of Medicine. I mean, very, very similar. We take into account what we do. They do MCATs. Dental medicine does the DAT. Is that what you guys call the DAT? I like that. Yeah. And then we do the PCAT. So it's also act thing at the end of it. So it's the PCAT score, and then we look at GPA as well. So the PCAT score, ours is a 100-point scale. So the average of our students last year that got into our college, it was a 70, which is pretty good. It's one of the higher ones in the country for the average. And our average student getting into the SCCP, the average GPA is 3.5. The higher the better, of course. It is becoming more and more competitive. The academic record, we look at letters of recommendation, just like one was mentioning, make sure that people writing you the letters are going to write good letters, and that they're substantial, that they're not just like you. I've seen the ones where it's a little paragraph. Oh, this person's really nice, and they got a 4.0, and okay, thanks, you should take them. And we want to know some more detail. So if it's somebody that you've worked with, they can talk about your work ethic, your personality, your personality traits, the good ones, your academic record, all of those things. And you do have an interview, just like they do in the other colleges. In the interview, you will interview with 2 different faculty members, and everybody stresses about it, but it's the typical types of questions. A lot of people are asking these behavioral type questions now, not so much maybe what are your strengths and weaknesses and why do you want to come to pharmacy school, but it's more, so if you were in this situation, what would you do? And it really, those kind of behavioral type questions really get to the core of the person, I think. Or name a situation where you were, in this and how you got out of it, or something like that. Those are a lot of the way that interviews are going these days. And so those, your pre-pharmacy requirements, which I'll put up there in a second. And then again, like was mentioned for the College of Medicine, the extracurricular activities, your work experience. So again, somebody who's never, when I'm interviewing somebody, they've never worked in a pharmacy, never stepped foot in a pharmacy before, but they want to become a pharmacist. I say, well, how do you know you want to be a pharmacist? If you've never worked, well, I don't know, it seems like a good thing. Or I've seen it on television, or I've seen my own pharmacist, and it's not quite. We want you to get some, even if you can't work in a pharmacy, if you can't get internship hours, it's good to at least do some shadowing. At least if you've done some shadowing in a hospital pharmacy or maybe a community pharmacy, you get some experience that on an interview you can speak more to that. And then you have a personal statement that's required. Why do you want to come to pharmacy school, and why the SCCP? These are the prerequisites, which again are listed on the website, and you can always refer to that later. And again, there are times when we can, if you have questions about what will count, just ask us, and we can let you know. I hate to put money up here, but it's just talking about the amount of money. Of course, in-state is much cheaper, so it's better financially to be in-state tuition. But you can see there, we do offer out-of-state scholarships for any out-of-state folks, but it's a little pricey for the out-of-state. It's pricey for in-state too, but all of the health professions are. But just think, when you get out there, really with all of these professions, you'll be making pretty decent money. It's pretty good. I'd say the average, those dental medicine numbers look higher than I expected. Like really didn't expect that much. What's that?
Kids are just way too smart.
Yeah, that's right. Yeah. No, so I think the average, I was looking at our average student who graduated last year, the average, the salary that they were offered was about 100, it's like 130, depending. But community pharmacies really pay the most. Hospital pharmacies and academia is always the least paid. But I love teaching, so there we go. So, but it's all good. It's a good salary. You can't complain. And so that is pretty much it. And I will have, I'll be over at the table over here if you guys have any questions. Please come talk to me. I also have some, additional specific information if you're interested in signing up for our to get emails or newsletters. I have
she said, my name is Lauren Smith. I am the recruitment coordinator at the College of Health Professions. I'm glad to see everybody here tonight. I am going to talk really quickly. Reason is College of Health Professions is a little different because we don't have just one program. We have 11 separate programs. We have bachelor's degrees, we have master's degrees, and then we have doctoral degree programs. I have brought with me, hold on 2 seconds. Sorry. But I brought with me students, and I do feel that they are probably the best people for you to talk to. They're the ones in the programs. And so I have Sarah up here. She is a first-year PT student. We have Mo. He is a second-year MHA student. We have Kalina, and we have Virginia and Meredith. They are all physician assistant students. And then Mia is a PT student as well. There's one of my, I have 2 slides. There's one. There we go. But like I said, the College of Health Professions is a little different because we are going to offer 11 separate. We actually are the largest on MUSC's campus. We have about 750 students. And to give you briefly, these are the programs that we offer. This is my one slide. Anybody know what a cardiovascular perfusionist is? You know what it is. How many of you just heard for the first time what, yeah, okay. You're not alone. That is our one bachelor's degree level program. It is for those of you, if you're interested in going into healthcare, working in an operating room, you are part of the open heart surgery team. You are keeping the person alive on the table while the cardiovascular surgeon is doing an open heart surgery or is actually going to be doing a large transplant surgery like a kidney or a liver. They run the pulmonary and the cardiovascular machine. It's a huge machine that basically keeps the person alive while the doctor's working. That's our one bachelor's degree level. It's got 60 prereqs. We have booklets over here. I'm not going to go over all of that information, but you can come in as a bachelor's degree after your sophomore year and start it. Even though a lot of our students have never heard of it before, they end up getting a 4-year degree. They're just going to come back for 2 more years and get another degree. Master's degree program. CSU has a phenomenal nursing program. We have got one nursing degree program underneath our umbrella, anesthesia for nurses, CRNA. Who knows what a CRNA is? Yes, I heard it. Certified Registered Nurse Anesthetist. Say that 10 times fast. Throw that TH in there. These are the people who are making sure that you are pain-free during a surgery or that you are asleep and pain-free during a surgery. They are going to be master's level 28-month program that comes in. You get your RN, you get your BS in, you come in, work in an ICU for a minimum of 1 year, and then begin our program. And then graduate to make the big bucks. Physician assistant. This is the #2 most needed career in the entire United States. This is also supposedly, according to CNN Money, the #2 happiest career. People love what they do. They love they're in healthcare. They're working with people, and they can work in all different areas of healthcare. It's a master's degree level where our students are going to be coming to us for 15 months in the classroom. They're going to be out 12 months doing 9 different rotations, and they're going to graduate to become a certified physician assistant. Within the state of South Carolina, you can work 45 miles or 60 minutes from a practicing physician. So you're going to work with a physician, but telecommunication, the wave of the future, that means you have to be a phone call away, basically. You don't have to be in the same clinic with them at the same time. You don't have to be in the same zip code. That's why it's very popular. Occupational therapy, that is a bachelor's degree. That is a 28-month program. Anybody ever been to an OT before? Yes? Yes? Anybody been to a PT before? That seemed to be a little more popular. OT and PT, talking underneath the doctoral level, we have physical therapy. OT is actually one of the top most needed careers in the United States, as well as PT. OT, the joke in South Carolina, we're the best OTs in the state. That's because we are the only program in the state. Same goes for PA. But that is a great rehab facility if you want to work with somebody who has had some sort of physical or mental incapacity that needs to be, elevated to a status where they're able to live life to the fullest. you are on the track, you love healthcare, but you can't stand the sight of blood, or you don't ever want to be working with patients, you want to be on the business side. That is what healthcare administrators do. They run the businesses. Whether it be a doctor's office, whether it be a hospital, you're the chief financial officer, you're the head of human resources, those are going to be people with backgrounds. You've all heard of an MBA. An MHA is for those individuals wanting to work in the healthcare system. And then I spoke a little bit about physical therapy. It's a 3-year program. It's DPT, doctoral of physical therapy, doctor of physical therapy, excuse me. But that, we have 2 students here, so they're able to talk a lot more about that if you're interested. If you've had an injury, you would like sports, or you want to be able to work with somebody who has some sort of movement dysfunction, and you want to get them right back on the path where they were before the dysfunction. And then we have our doctoral program for people who, in health administration, it's a DHA, that's a career development way down the line. And health and rehabilitation science is a new PhD. That is for people who have got some sort of background in healthcare, who are looking to get their PhD. Professors get PhDs, so healthcare individuals. So I have students at the table. I've got lots of giveaways. I've got booklets. I'm going to stop talking now so that you can answer them questions. But thanks very much.
Associate Dean, Missions and Career Development,
Look,